All right, darkness isn't the only thing that scares Fraidy cats. It seems a trip to the dentist can raise a little fur, too. And Dr. Charles Martin is here with us this morning to talk about sedation dentistry and how it's changing the smiles of Fraidy cats. You get a lot of Fraidy cats in at your place?
A lot of Fraidy cats, yeah. Yeah, sedation dentistry has really helped a lot of people overcome these deep-seated fears and anxieties that prevent them from going to the dentist.
Okay. So you say sedation dentistry. Does that mean I can come in, you knock me out?
Generally, we don't need to do that. Generally, it's what we're trying to do is
depends on the level of
maybe
Fraidy
for
cat.
you, but for most people, it is really taking the edge off. Physiologically, what happens when someone's afraid? Their senses are heightened.
Yeah.
And so the responses are different. You know, when you're under a lot of fear, adrenaline goes up and lots of things. There's that flight or fight syndrome. We hope you're not fighting us. Maybe want to leave, but the whole idea behind this is to take the edge off, decrease the anxiety, to make it comfortable. In fact, for most people, what happens with sedation dentistry is the edge is gone, that hyper-responsiveness goes down, and then get comfortable getting their dental work done.
So if they're all hyped up, so to speak,
right,
even a little touch that normally wouldn't bother them, they're going to jerk and go. Right. So just kind of calm everything down. And does it work in almost everybody?
It does work. Thank goodness. Of course, different people need different techniques, different amounts. For most people, it's taking a pill an hour or so before the appointment. And then they take the edge off. Of course, when you do this properly, you have to have someone bring you and take you home because you know it's not, you're not going to be legal to drive.
Yeah. Let's talk about the results. I would imagine not only does it make it better for them,
right,
it makes it better for you.
Well, it can be. Yeah. You know, when someone has an anxiety or a fear, this helps them overcome that. For many patients, we find that once they get to understand what we do, how we do it, they don't need it anymore. You know, maybe they've had some experience as a child, a little bit as an adult somewhere, bad experiences. I don't want that again, which is a normal response. And using sedation, we're able to get them so they can get the dentistry done. They can smile again and feel comfortable about going to the dentist.
Yeah, you said it's a normal response. It's also an intelligent response.
Well,
if something hurts, then you
nobody wants to hurt. Nobody wants to hurt.
So obviously, once they get comfortable with you and they realize that this is not that kind of experience and it's going to be a positive thing and that they don't have to be all that anxious,
right?
And obviously, then things change a little bit. You always bring those great before and after photos, so let's take a look at those. Let's talk about this guy. Before and after, pretty cut and dried here on this one.
Yeah, this was using a number of techniques all together, which this gentleman really benefited from. So he put a smile back on his face, and he liked to travel and go to different places, and you can see that it puts a smile on his face.
Yeah, definitely likes to flash it too. All right, good work, Dr. Martin. Thank you very much. Folks, don't be afraid of a new smile. It's just around the corner.